Thyroid function tests first. TSH, thyroid stimulating hormone. Initially, in that hyperphase, it'll be low, suppressed.
Because there's already too much thyroid hormone floating around.
Exactly. And free T4, the active thyroid hormone, will initially be high.
And then later, in the hypophase.
They'll flip. TSH will become high as the pituitary gland tries to stimulate the underactive thyroid, and free T4 will be low.
Okay, that reflects the phases. But what else? There was something mentioned as a very strong indicator. ESR.
Yes, the ESR, erythrocyte sedimentation rate. Your sources really emphasize this one. It's typically markedly elevated,
How high are we talking?
often greater than 50 millimeters per hour, sometimes even over 100. It's a non-specific marker of inflammation, but such a high level in this context is very suggestive of SAT.
Okay, so really high ESR is a big red flag.
Very big one. Elevated CRP, C-reactive protein, is also common, for the same reason systemic inflammation.
Right. And what about thyroid antibodies, like the ones in Hashimoto's or Graves'?
That's another key point. In subacute thyroiditis, those specific thyroid antibodies like anti-TPO or antithyroglobulin are typically negative or may be present only at very low levels.
And testing for those helps rule out those other conditions.
Precisely. High levels of those antibodies would point strongly towards autoimmune thyroid diseases like Hashimoto's or Graves' disease, not SAT. So their absence is important diagnostically.
Got it. What about imaging? Does an ultrasound help?
It can, yes. A thyroid ultrasound in SAT often shows the gland looking hypoechoic, which means it appears darker than normal tissue on the scan.
Okay.
And heterogeneous, meaning the texture looks patchy or irregular. And another really useful finding on ultrasound, if they use Doppler.
What's that?
Doppler ultrasound looks at blood flow. In SAT, there's typically decreased or absent blood flow within the inflamed thyroid tissue.
And how does that help distinguish it?
Because in Graves' disease, another common cause of hyperthyroidism, you usually see markedly increased blood flow, sometimes called a thyroid inferno. So seeing low flow argues against Graves' and supports SAT.
Interesting contrast. And there was one more key test mentioned quite prominently, RAIU.
Yes, the radioactive iodine uptake scan. This is often very helpful in sorting things out.
What does it show in SAT?
It shows decreased uptake, very low uptake, in fact.
Why is that?
Because those thyroid follicles are inflamed and damaged. They're not functioning properly, so they can't effectively trap the radioactive iodine tracer that the person is given for the test.
And that's different from other causes of hyperthyroidism.
Very different. In conditions where the thyroid is overproducing hormone, like Graves' disease, the RAIU is typically high because the overactive cells are grabbing lots of iodine.
So